So guys, the next segment is kind of some three quick lightning talks from three of the leading technology purveyors that are also, like Hint, focused on the direct care space. Not pitching product, but talking to you about what their experience has been in DPC and sharing data and insight to the degree that they have it on trends that they're seeing essentially through their technology to understand kind of DPC by the numbers, so to speak. So with that, let me introduce Ray. Is the founder and CEO of Spruce Health to kick us off here. Thank you, Ray.
Hi, everyone. I'm Ray Bradford, founder and CEO of Spruce Health, and thanks for the time. And it's great to see so many customers and partners in the audience. At Spruce, we do patient communication, patient engagement, and telemedicine or virtual care. And so what I want to talk today about quickly, 8 minutes quickly, is about from that position, significant trends we're seeing in terms of the future of care delivery and what we see there in terms of opportunities and challenges for DPC practices as part of that. I also want to share some internal data around those trends. And then lastly, talk about what we're doing to support DPC practices looking at that. I think one key thing I'd say is these are opportunities and challenges across types of care, but I'd say the great thing about DPC as it regards these trends is the business model, the economic model can actually accommodate them versus being fundamentally at odds with what you see in fee-for-service. So jumping into the first one, DPC has obviously set the standard when it comes to patient access. That's one of the key differentiating points and selling points for DPC. However, I'd say even relative to the high bar that DPC sets in terms of access, patient expectations are dramatically ratcheting up, and their patterns and expectations around communication are evolving in terms of wanting care anywhere, anytime, and in a channel of their choosing. So they want to be met where they are in terms of communication. And so that doesn't mean that you need to be on Snapchat immediately, but it does mean that healthcare is not immune from those type of behavior changes that you see elsewhere in the consumer market. So that's kind of generic. So I wanted to talk about specifically within that, what are the patterns and trends that we see, and how to get ahead of them and really turn them into differentiating elements for your practice, because as I said, they can be compatible with your model, unlike with fee-for-service. And so I'd say the first one is really phone calls moving to text. I think we all have some general sense of this. Phone calls still very important. We support a second phone line on Spruce that automatically documents all of your phone call interactions. And so that kind of legacy channel, if you will, is still important. We expect the immediacy of text. 80% of Americans are using their phone for texting. 6 billion text messages are sent every day. And those differences aren't that big across demographics. Some people think that is a big difference between millennials, non-millennials on that. Everyone's texting, and healthcare is not immune to that. And so like when we look at our data, we see that as well. We see more text message-based conversations happening between patients and their care teams than we see phone call-based encounters in that setting. We also find that patients who have the Spruce app, in recent deployments, 80% of them are texting the care team. So things are definitely moving towards text. And I think that generates a lot of fears. And one of those fears is, am I opening the floodgates? Am I going to get texts all times a day? Is this going to ruin my kind of lifestyle, so to speak? Are people going to abuse the channel if I open it up, so to speak? And I think that's a really interesting question. I think what we found in looking at our data as best we can is patients are far more respectful of the physician's time than you might expect in your work. And so the data that we looked at around that is looking at looking at encounters that took place on Spruce, full encounters where there was a chief complaint. What we found was that the median number of messages sent by a patient was about 3, and the median number sent by doctors was also about 3, with a P90 of 6 for the doctor, meaning of times where there are more than 6 messages sent. And that's for a full encounter. And so I think in general, patients were just more full of time there than you might expect when we were looking at the data. I'd say the second part of that is just around that being team-based. And so one of the things that we've found in our experience is responsiveness matters way more than license level. And so at the risk of dinging some egos, it really isn't about, you want to conceptualize a relationship with my doctor. I have a personal relationship with the practice. They're listening, they're there. But in practice, I'm more than happy, in fact, in some cases more happy, for it to be anyone on the team getting back to me quickly. And so what we found in empowering kind of direct-to-consumer telemedicine as well is that if you look at the patient reviews of the telemedicine encounters, 20% of those reviews are mentioning the care coordinator, which is as much or more positive praise for the doctor. And I think it speaks to these touch points, the responsiveness, feeling like someone looking out for you. That doesn't just need to be the doctor. And so if you think more holistically in terms of the team-based approach to care, you can get a lot of benefits of goodwill without necessarily needing to take more of the physician's time. I'd say, and then talking about how do we kind of help support that trend, our goal with Spruce has been to let you meet patients wherever they are and let patients, regardless of how patients are trying to get in touch with you, to unify it all into one simple place where you can see everything that's happened on a per patient level. So whether it's call, SMS, text, email, secure text, any form of communication that you might want to, there might be occurring between the practice and the patient, having that all go in one place, having that be team-based so anyone can respond to the patient so you can collaborate around that patient's care, and that it automatically can go into your EHR chart, and then that patient contact list can come in from Hint. So really speaking to that power of that Hint Connect ecosystem. But then I want to talk about a couple more points with that. One is that don't just think about it in terms of communication channels of phone, text. There's new levels of care that can be opened up. So people think about video visits as this point in the spectrum between a call, a text, and an in-person encounter. And video visits can definitely create this new level of care. But if you think more creatively, there's also a lot of opportunity around asynchronous visits. And we look at our data and we look at what patients have really enjoyed and what doctors have enjoyed. These async visits are in many ways more popular. By that I mean you come in with a chief, the system asking all the questions that would be asked live in a conversation. When did it start? How badly are you coughing? It might sound like a questionnaire, but if it's done in an adaptive, easy way, those Spruce visits, as we call them, are a win for everybody. What we find in the data is patients love them because they can do them in a meeting. They don't need to schedule it with you. They don't need to try and time it. You could be doing one right now during this call. I won't be offended. So it's convenient for patients, but for doctors, when we look at the data, the time it takes to do an asynchronous e-visit, we find the median time it takes is 6 minutes across this data set. And we've powered, many people don't know this in this community, but we started out powering one of the biggest direct-to-consumer telemedicine clinics out there. And so looked at a sample set carved out from that of 10,000 visits in an anonymized way to say, how long does it take the doctor on a median basis? 6 minutes. And the faster doctors that are comfortable with that are doing that more on the order of 2 minutes. And it's taking the patient similar sets of time. And so it can both be faster in a lot of regards, more efficient, but it's not sacrificing the quality of care, and people don't feel rushed. So that's a subtle point to get into for a fast talk, but I would say that just thinking about creatively about care beyond the exam room and those four walls, how can I reinvent the workflows around that? How can I find new patterns where everyone wins? It's more efficient for me, but it also feels like greater access for the patient, and they have more control. They can do things on their own time. And the last point I make there that's non-proprietary data is just looking at Harris research data. Patients are saying, more than 50% are saying they choose a doctor with an app over one that doesn't have one. They choose a doctor who supports virtual care over one that doesn't. And that is across all demographics. So it goes up to 70% for millennials, but even in baby boomers, it's more than 50%. So that these trends are more universal than you might think. The last thing I want to just touch on quickly as a bonus round is we think panel sizes will go up and care will get more connected and more coordinated. Panel sizes going up, I think the point we'd like to make here is, being in the community now for a while, it oftentimes starts with what's the number? And then assuming in that a certain fixed workflow of how care gets delivered. Well, I have this many hours a day, the appointment length is this time, this is how it works. That all makes sense to a certain degree, but when you think about touch points beyond the office, that's a new workflow. It's a brave new world where you can generate a lot of touch points with very little effort. And so the kind of equation changes in ways where everyone can win. And the example I'd give of that is, say, bulk messages in Spruce, where you can tag your panel, create different subsets, VIPs, diabetics, whatever it may be, and do a bulk reach out that is experienced as the patient as being personalized to them, even with their name in it. They don't necessarily know how little time or much time that took to generate, and they can respond in their own way. But everybody wins there because it's more efficient. You can touch more lives, but it doesn't necessarily take more time. And so that's kind of a close on. And then the last point of care being more coordinated in terms of once you kind of digitize the care, quickly tagging in other practices and other specialties to really have a virtual patient-centered medical home or a virtual medical neighborhood is, once again, a new workflow that's less possible in an older world. Thank you for the time. And the last thing, a bonus round on the panel sizes, our medical director wanted to make sure I got this in because he spent so much time writing it. Wrote a white paper on the secrets of direct primary care in terms of landing employer contracts. If anyone's interested in that, wanted to put that up there as well. So thanks, everyone.